I want to bring in OBGYN and the president and CEO of Physicians for Reproductive Health, Dr. Jamila Parrott. It's good to see you, doctor. You have called this fragmented access to abortion care, justice by geography. How could stricter access to mifepristone change how you and your colleagues treat patients?
It's going to have a devastating effect. We know that more than half of all abortions done in the United States are done using these medications, and a growing number are done using telemedicine or virtual medical care services. We have recent data from the Society of Family Planning that shows that almost 15% at this point are done using online or telemedicine services. We also know that abortion is now and has been significantly restricted in many, many states. So limiting the ability of people to be able to access this care through telemedicine, limiting our ability to be able to care for people in their own communities is going to continue to worsen reproductive health outcomes, in particular for those who are most likely to experience poor health outcomes. Black women, Indigenous birthing folks, people of color, young people are going to feel the brunt of these restrictions.
We talked about the fact earlier that even if you're in a place where abortion is legal, it could impact you. And there was this new study, I'm sure you saw it, from the Journal of the American Medical Association this week that found that in the first 6 months after Roe was overturned, the demand for self-managed abortion pills spiked. In fact, they quadrupled compared to the month before that decision. So if access shifts, the question becomes, what other options do patients have?
Let me say a couple of things about that. One, self-managed abortion care, self-managed care in general is not new. People with restricted access, people who have the desire to care for themselves in ways that are outside of the traditional medical system have been doing so for centuries. Self-managed medication abortion is safe. It is effective. The recent study that you refer to shows that to be true. 27,000 people in the first 6 months have managed their abortion safely and effectively, and those are just the people we've been able to count. So that's the first thing that's most important to know. But the risk here is not a medical risk. We know that these medications are safe and effective. The risk here is a legal one. We have rogue prosecutors with anti-abortion intentions that are jailing, arresting, prosecuting people for caring for themselves in their community. The legal risk is greatest here, not the medical risk. These medications are safe. They are effective, whether I hand you the medication or you manage it in your home, in your community, with folks that you love, you trust, and who provide the support that you want and need in this moment.
Dr. Jamila Parrott, thank you.
Hey everyone, MSNBC has a new and improved app. You'll get real-time alerts and analysis, live blogs, in-depth essays, video highlights, and the best 2024 election coverage. Download the new MSNBC app. Here's how to do it. You tap on the App Store on your phone. You hit search on the bottom right corner. You type in MSNBC. You click on the MSNBC app. You click on Get or the cloud icon and enjoy it.